Y'all ready? Oh, me. Are we live and on stage now? Okay. This is kind of exciting. Most of you know who I am. Those of you that don't, I'm Don Warren. I'm a dentist from Clinton, Arkansas. It's a small town in the hills of Arkansas. He does not live there. It is not named after him. And yes, I supported him. Okay, now that that's cleared up. Oh. This work that you're studying today, I feel like is probably one of the most major missing links in total wellness we can find. In wellness, I know, and I've seen all over the nation and all over the world now, that total wellness cannot be achieved without chiropractic. Now, I may step on a few DO's toes, but it can't be achieved without DO's either. And it can't be achieved without RNs. And it can't be achieved without dentists. And if I've forgotten another profession, don't worry about it. But total wellness is not just one view of the human body. One view of the human body allows you to see the human from one aspect and one aspect only. And if that's the only avenue you look at, then you're going to be a failure part of the time. Has anybody in here ever been a failure? Raise your hand if you've been a failure. I've never been a failure. Never. I've had some danged expensive learning experiences, but I've never been a failure. Okay?
Ask that question again.
Don't ever. Now, how many people have been a failure? Okay, that's better. Okay. Some of you know me. I teach Dick's work around the nation, but I want you to know that there's some other things about me. I'm a dentist in Clinton, Arkansas. I've taught crown and bridge and occlusion techniques at the University of Tennessee College of Dentistry. I hated the bureaucracy of it. I got out of it because I didn't like that. I said I'd never teach again, and I are doing it now, okay? I'm a diplomat of the American Academy of Head, Neck, Facial Pain, TMJ Orthopedics. It's a group of dentists from all over the world that specialize or have limited or have special interest in the treatment of head and neck pain. It just so happens that I've located the cause of head and neck pain being the symptom. The causative factors may be the toes, may be the ankle, may be the knee. So just because the patient has a symptom, don't look just at the symptom. Look at the whole body. A friend of mine from up in Oregon said the human body is divided into parts by acts of legislators, not by acts of God. And contrary to popular belief, all the parts work together. Folks, remember that. If you get a patient that you have a lot of problems, they seem to just keep coming back and keep coming back and keep coming back. And if you're doing your spinal adjustments, you're doing your cranial adjustments, you're doing your nutrition, and they just keep coming back. Step back. That ought to be a red flag for you that something else may be amiss with that patient. What else could be amiss? You've dealt with the nutritional, you've dealt with the structural. You can have a dental component where a tooth that hits as little as 10 microns, 1/10 the thickness of a hair on your head. If it hits out of kilter, that little amount, it can perpetuate a chronic subluxation. It can cause a rib to actually lift up away from the sternum. It can cause the symptom of a chondritis, okay? It can cause muscle spasms, trigger points. If that doesn't work, you look to the emotional through Scott Walker's work. We used to tell people that didn't get well up to a certain point, you know, they didn't completely get well, that after a while of frustrating work, that it was all in their head. It was emotional, and there wasn't anything I could do for them. So we'd send them to the psychiatrist. They'd come back 2 years later worse than they were before, plus they're hooked on drugs. you know. So I quit doing that. So Walker's work sees the emotional. Science, medicine, if medicine is a science, has tended to take one major factor out of the wellness, out of healing, and that is God. And a lot of your patients that are these chronic patients are not ever going to get well until they get that relationship in their life right. Are you trained counselors in spirituality? I'm not, but I know some that are, and I'll be sure to refer those patients out. If there's a spiritual component to a patient's problem that they have, I don't want them in my office. I mean, I'll be glad to see them after they get rid of all this junk, but I really don't want them in the office. I don't want to deal with the garbage that they're carrying along with them. Let's see, I got the nutritional, the structural, the dental, the emotional, the spiritual. Sometimes I find that some people have a problem, I would consider it with their soul. They really have a deep-seated problem with the way they're made up. They have a problem with scars. German technique called neural therapy is they take present-day scars and inject them with a local anesthetic, and it expands the scar. And actually all it's doing is expanding say you get cut, and the energy lines that go across an area of skin suddenly become cut. Now, as this skin starts to heal in and forms a scar, the energy lines don't mesh. And when you inject it, or when you do myofascial releases, you pull that scar apart, and it allows what I see is it allows the lines of electricity running across that scar to join back together again. Every time you find one of these perpetuating factors, deal with it. Deal with it the best of your knowledge, whether that's you dealing with it personally or referring it out. Once you deal with that, you have just passed through a doorway for your patient that you'll be able to go into the next step. And guess who tells you when to take the next step? Who? Your patients. Doctors, do me a favor. Leave your egos at the door when you walk in with a patient. Leave your egos at the door. When you leave your ego at the door, your patient will always create a symptom to draw attention to the next step that they're ready to take, not that you're ready to take. An example. Patient comes to me with a locked jaw. They can't get their mouth open but 10 to 17 millimeters. They can't even put their mouth around a Big Mac patty, let alone the Big Mac. That's a non-food though, isn't it? Okay. Okay. So they come in. As the dentist, I see they have a locked jaw. Old protocol would tell me that I needed to put a piece of magic plastic in their mouth. Everybody know what magic plastic is? That's the orthotic or the splint that goes in between there, jacks their jaw, they come out like this. But what if that locked jaw was due to a spleen infection? What if that locked jaw was due to a subclinical pneumonia? What if the locked jaw was there because their left ankle was out of place? And I put this magic plastic in their mouth. And I'm going along. You know what will happen? They'll create their symptoms all over again. Even with the magic plastic in their mouth, the pain will all come back. Now their body's saying, hey, wait a minute, you're missing something. You go back and you start checking, oh my gosh, the ankle's out of place. You adjust the ankle, oh, the pain's all gone in the face. Their jaw functions fine. Now they go to put their teeth together. Guess what? The orthotic just intruded their teeth. They can't get their back teeth together. Oh, that's okay, I'm a dentist. I can now restore their back teeth. Well, that looks like that's a new cruiser or a new airplane or something like that, you know. Somebody says, well, gosh, Doc, what does this mean to you? Well, it's a new boat or a vacation. Not really. Don't do that to your patients. On the way up here, I sat down in the seat on the airplane and I read Dr. Versendal's new book, the new 19th, 20th, 30th, I don't know. This book right here. When I read this book, you know what, and I did not have this. When I read this, it dawned on me that this is a summary of a stack of papers that I have in my house this deep of notes that I've taken at over 70 Versendahl seminars. It's all in the book now. And now he's got this addendum here that I hadn't even seen until this morning, and I don't think he saw until this morning, okay? That's available. As soon as I get this, I'm going to read it too. So I know there's some new stuff in it. These are very important. You can't do this work without this. What if you can't push on somebody's arm? If you can't push on somebody's arm, get the book, look it up in the back of the book. How do you get it into your practice? How many of you, when you first discovered CRA, you began to become what I call a born-again CRA'er? Everywhere you go, every party you go to, you're always sitting over in the corner. And people are walking up going, test me, doc, test me, doc, okay? Everywhere you go, you're talking CRA, CRA, CRA. How many of you did that? I did it. How many of you lost friends because of it? I did. Guess what? They weren't your friends anyway. Okay. But chill out a little bit. Get a life. Go fishing, go hunting, go bowling, whatever you do for fun, do it. Study at night, do whatever, but get a life, okay? This work is so overwhelming. It's so much fun. It brings back the excitement to your practices. When I first started, there were no videos. Now there are videos of my courses. There are videos of Dr. Versendahl's courses. Kim does an excellent job. If you don't have videos, you've got to have them, okay? If you don't have a library of videos at your office or at your house, you're not worth diddly. Notice I didn't put anything at the end of that. Wasn't that nice? People say, Doctor, how can I become competent at this? If you don't make the investment, you can forget it. You can literally forget it. You've got to have it. Another one, this Gulf War thing. They called me to do a little talk up there, and guess what? I was speaking to the Academy of Head and Neck Pain the same weekend. If you can get this documentary from Kim, do it. You can take it to doctors around you. You can take it to the guard units that are around you that have members of their guard unit that are having the exact same thing. These are doctors of all persuasions that have gone in, they tell their protocol, they talk about what they do for their patients, they give their experiences, they give some testimony. Pharmacists, scientists, chiropractors, MDs, nutritionists, they're all on there. Get this, RNs, they're all on here for you to get this and explain to people what you're doing. Run it in your reception room. It's great, okay? I'm going to put on another soapbox here. There we go. In the past, we've always taken videos of the Versendahl seminars, and we've taken videos of my seminars, and we've passed them out to our patients. How many of you all have done that? I've done it. I've passed out hundreds of them. What happened? How many of your patients can do CRA better than you? How many of them have the background in biochemistry, physiology, and anatomy that you have? It's a little shameful, okay? When your patients are trying to do CRA, they can't get nutrition for this. I call it bastardizing the technique, okay? They will in turn send these patients to you. They're friends, and their friends will come in and they're ready for a CRA exam. And you sit down and you tell them, you know, I found this, this, and this. Well, my friend didn't say that. And my friend wouldn't lie to me. You're just trying to make me buy more nutrients. What has that done to your credibility, doctors? It's bad. Last year, I got with Monty Koch of Cottage Video Post. He works with Kim. and I donated all my time to a video, an introductory video for your patients, I do not get 1 penny from this at all. I don't want it. But I don't want you to send out your video library to your patients. In this, I explain all the facets of the testing technique on the tape so that the patients will understand why they're putting their arm out here. Why do I recommend standard process nutrition? Why? Because it gives me a predictable result. Okay? It gives a little history about standard process labs. It gives something about Dick. It talks about the human body. It's customized to each individual doctor's office. I send a tape out to every new CRA examination that I do. And when they come in for their exam, they can bring the tape back. But if they don't, they have to agree to show it to some of their friends. They have video viewing parties, okay? It has my name on it. It has the explanation, has my phone number, has my address, as it will for you. Are there order forms in the packets? At the back desk. These things come in groups of 10. I've passed out over 150 of them. They keep recirculating, okay? It keeps bringing more patients into your practice. More patients. I had for the last 5 years in my practice, we've averaged over 1,000 new patients a year. Can your practice stand 1,000 new patients a year? I didn't think I could fit 1,000 new patients into my practice. But when I did, it just all flows. It flows. And your successes will breed successes. And your referral will breed further referral. Have the integrity when you use this work that if your treatment will not work for that patient, have the integrity to send your patient somewhere else. Be ethical about what you do. And you will, if you're ethical and you're conscientious, folks, you will be successful. You will be. It'll take you to be real successful, 2-3 years. But you've got a learning curve that you've entered into now. How many of you are here for the first time today? Any of you believe everything you've seen today? I've got a bridge I'd like to sell you. You know, you better look at this thing just as skeptical as you can be to start with.
But I've been using it.
Okay, but remember, always look at this thing objectively. Always look objectively. Thermographically, I've shown that the reflexes are where Dick says they are. They are 1/10 to 1/2 a degree centigrade hotter than any other tissue surrounding it. We used to sit at coffee, and he'd say, on Sunday morning before we catch the planes to go home, he'd say, just turn it off. You know, if you just sit there and watch it for a little bit, it'll be hot in a minute. I thought that was a figure of speech. He said, now if you turn it off and you continue testing, it'll stay turned off. I thought, sure, Gil. Gil was my next door neighbor. The little boy lied a lot, okay? And I didn't know what was going on. Thermographically, folks, when you rub down on that reflex, it goes back toward the normal skin color, thermographically. If you stand back and wait, in 15 to 20 seconds, it's back to its original dysfunctional color. If you erase it, it goes back toward the normal color of skin. If you start your testing with other reflexes, that reflex stays shut off and it stays that dysfunctional color, or stays more toward the normal until you quit testing. And once you quit testing, in about 15 or 20 seconds, it's back to its dysfunctional color. We're dealing with the electricity of the autonomic nervous system. It knows everything that's going on with your body. You just got to know to ask the right questions and trust that the answers you get are going to be the right answer for that patient and not what you're thinking is the right answer because I'm the doctor. and I always know what's best for my patient. Folks, that's your ego talking. That's not you listening to your patients. Dick, come on up here. I talked long enough. Folks, get one of these and get the videos. The set of videos for the Gulf War, 2 tapes, $50.